Your body whispers before it screams. But what if you could catch the whispers early, before they become a crisis? Today, we're revealing 7 warning signs of health problems in old age that many people ignore until it's too late. If you're over 60 or care for someone who is, this video might just save a life. Don't forget to subscribe to Senior Health Tips. Hit like and share this video with your loved ones. Let's get started. 1. Unexpected weight loss. Let's begin with something most people celebrate: losing weight. But in older adults, sudden or unexplained weight loss is often a red flag, not a victory. If you've lost more than 5% of your body weight in 6 to 12 months without trying, pay attention. That could mean a drop of just 7 pounds for someone who weighs 140, and it matters. Why? Because your body is telling you something is wrong. Maybe it's an overactive thyroid. Maybe it's cancer. It could be diabetes, depression, or even malabsorption from gut issues like celiac disease. In the elderly, muscle mass tends to fade fast, and with muscle goes strength, balance, and independence. You might notice your pants feeling loose, your ring slipping off, or your watch hanging oddly on your wrist. Don't brush it off. Don't think, maybe I'm just not eating enough. Get it checked. Early detection makes all the difference. 2. Confusion or memory loss. Have you ever walked into a room and forgotten why you were there? That's normal, but if it keeps happening or worsens, it's time to look closer. One of the earliest signs of cognitive decline is subtle memory loss. It starts with small things: forgetting names, missing appointments, repeating stories. But confusion can also be a sign of something more urgent, like a urinary tract infection. That's right, UTIs in older adults don't always come with pain. Sometimes they show up as mental fog, agitation, or even hallucinations. Other culprits: medication side effects, dehydration, low blood sugar, or the early stages of dementia. The brain is your body's command center. When it gets scrambled, everything else falls out of sync. If a loved one starts behaving differently, acting withdrawn, easily irritated, or forgetful, don't just call it aging. Call the doctor. 3. Shortness of breath. Next is something many seniors notice when climbing stairs or walking outside. You feel winded, maybe even dizzy. Maybe your chest feels tight. That's not just getting older. It could be something far more serious. Shortness of breath, or dyspnea, is often a warning sign for heart disease. It could mean congestive heart failure, where your heart can't pump blood efficiently, or it might be a lung issue, COPD, pneumonia, or even a silent pulmonary embolism. Breathing is your body's most fundamental need. When it gets harder, it's not a small problem. If you feel like you're gasping for air after light activity, or even while resting, see a doctor immediately, especially if it's paired with swelling in the legs or fatigue. It's always better to check than to wait, because breathlessness is never just a breath away from danger. 4. Changes in bathroom habits. Let's talk about something no one likes to talk about: bathroom habits. Constipation, diarrhea, frequent urination, blood in the stool, changes in the color or shape of your bowel movements. Yes, it's uncomfortable, but these signs could point to colon cancer, prostate issues, or kidney problems. Don't dismiss it as just something I ate. Persistent changes in bathroom habits are among the most overlooked warning signs. For example, if you're waking up several times at night to urinate, especially if you're a man, it could be a prostate issue. Or if you're straining to go every day, That could be a sign of a bowel obstruction or poor fiber intake. Bright red blood? That might be hemorrhoids. Dark, tar-like stool? That could mean internal bleeding. Listen to your gut. Literally, it's not impolite. It's intelligent. 5. Slurred speech or numbness. Imagine this. You're having a conversation with your spouse. Suddenly they start slurring their words. Their smile droops. One side of their body feels numb. What do? You act fast. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time to call emergency services. These are the classic signs of a stroke, and in stroke treatment, every minute counts. The longer you wait, the more brain cells are damaged, and the harder recovery becomes. Even if the symptoms go away after a few minutes, it could be a mini stroke or TIA. That's your warning shot, your one chance to act before a major stroke hits. Call emergency services immediately. Don't wait. Don't guess. Don't Google. Just go. 6. Frequent fatigue. Here's one that's easy to ignore: tiredness. But this isn't just being sleepy. This is bone-deep fatigue, the kind that doesn't go away after a nap, the kind that makes daily life feel overwhelming. Frequent fatigue can signal heart disease, sleep apnea, anemia, or chronic inflammation. It can even be linked to certain cancers or autoimmune conditions. If you're feeling tired after basic tasks, like getting dressed, walking to the mailbox, or talking to friends, something isn't right. The energy you have is like a fuel gauge. When it drops consistently, your body's engine might be under strain. Listen to that. Don't just drink another cup of coffee or blame it on the weather. Your body is asking for help. Are you listening? 7. Unusual pain. Finally, let's talk about pain. Not the kind that comes from bumping your knee or lifting something too heavy, but unusual, persistent pain, the kind that seems to have no cause. Chest pain, abdominal pain, jaw pain, headaches that feel different than before. In older adults, pain is often an early warning system for serious illness, and sometimes the symptoms don't appear where you'd expect. For example, a heart attack in women might show up as nausea and back pain, not chest pressure, or gallbladder issues might feel like shoulder tension. Never ignore pain that is new, unexplained, severe, or persistent. You've lived with your body for decades. You know how it usually feels. When something feels off, trust that instinct. Aging doesn't mean you have to suffer silently. The body always speaks. The question is, are we listening? These 7 warning signs may seem small, but they often point to something bigger beneath the surface. Catching them early is not just wise, it's powerful. So here's what you can do right now. Share this video with your loved ones. Leave a comment if you've experienced any of these symptoms. And most importantly, talk to your doctor about any concerns. We're here to help you age with awareness, strength, and confidence. Thanks for watching Senior Health Tips. Please subscribe, hit the like button, and turn on notifications so you never miss a vital update. Stay informed, stay healthy, stay strong,